Well, good morning, good people. It is great to be with all of you today as we once again take a moment to celebrate the importance of public health in our community. One of the silver linings, and there were some, not very many, of COVID, was the recognition of the importance of public health in all of our lives. The recognition that somebody's health in Wheaton should matter to somebody's health in Damascus, that somebody's health in Bethesda should matter to somebody's health in Silver Spring, because we are all connected in every way imaginable. And every decision that this body makes, every single one, directly impacts the public health of our community every day here in Montgomery County. And it is a responsibility that I and all of my colleagues take very, very seriously. We are fortunate to have extraordinary public health leaders and professionals in all three of our public, private, and nonprofit sectors. And we are joined by three outstanding leaders today who are national leaders in many respects and are on the front lines of ensuring the interconnectivity and addressing the social determinants of health that lead to disparities in public health that are frankly immoral. There's a lot more work that we need to do, but it is important especially that we take the time to recognize and thank the professionals that have chosen this profession, because not only do they save lives, but they strengthen communities. And so I know I speak on behalf of all of my colleagues in extending our appreciation to all of them. The theme of this year's Public Health Week is centering and celebrating cultures in health. We, of course, often speak about the fact that 4 of the top 10 most diverse small cities in the United States of America are right here in Montgomery County, which absolutely is something to celebrate. But we also have to recognize that that brings a special level of responsibility, and that is especially true in the public health space. Dr. Bridgers has been speaking often about the department's focus on providing services with cultural humility, and I couldn't agree more. So with that, I want to bring these three outstanding leaders to speak now, starting with Dr. James Bridgers, who is our acting HHS director. Dr. Bridgers.
Good morning. Thank you, Councilmember Albornoz. Thank you to the entire council, Council President Glass, Council Vice President Friesen, and the work that you continue to do with us under the Health and Human Services space. It is National Public Health Week, but as Councilmember Albornoz stated, the policies and the guidance that were set forth during the past 3 years were absolutely life-saving. We led the nation in our metrics. We have great colleagues behind me who will speak, but without our community, without our key stakeholders, without you, we could have not done this. We continue to do work. We continue to look at equity, diversion, inclusion. There's much work that we need to do around somatic and physical care. Mental health is at the forefront of our approach now under the Health and Human Services space. Look for more information about where we are going forward in the mental health space. We owe it to our community to lessen harm, to mitigate any risk, and suppress the further use of substances that harm and kill our adolescents. We hope that all of these things come together for the greater good. And as we operate in this space, we will prevail. Thank you.
Thank you so much. Dr. Davis.
Thank you. Thank you, Councilmember Albornoz and the entire council. I am Dr. Keisha Davis, your County Health Officer, and I'm excited to join you for this proclamation on National Public Health Week. As a generations-long member of Montgomery County and as a family physician, I understand the importance of public health, how policy programs and services impact our communities. And while the recent work of public health has not been without challenges, our public health employees have risen to meet the challenge with enthusiasm and dedication. I want to specifically recognize the efforts and focus on mitigating COVID-19 through offering masks, testing, vaccination free to the public. Without these efforts, we would have seen the impact of COVID-19 in our communities to have been much worse, and we will also have seen a much worse disparity. I want to echo how good we did with COVID in our communities and lessening that disparity. Our public health staff work tirelessly every day on important efforts such as disease surveillance, health services, collecting and analyzing data, conducting health education and outreach, and assisting and leading community groups and efforts. Public health is a cornerstone. It promotes and protects the health of people and communities where they live, work, worship, and play. The county health rankings came out last week, and Montgomery County, again, is at the top of the list for Maryland, but we don't rest on our laurels, and we recognize that we continue to look under the surface and make sure that we are working to mitigate health disparities, and our public health workforce and the work that the council does every day helps to mitigate those. So thank you.
Thank you. And Dr. Rogers.
First, thank you, Councilmember Albornoz and fellow council members for recognizing National Public Health Week. I, in part, was led into public health based on my own story. Being a single dad of 3 children in my early 20s, I relied heavily on Medicaid for myself, children's health insurance program for my children, food stamps to feed my children, as well as free dental care. So I understand the importance of the wraparound services that we offer within Montgomery County to ensure that our residents not only have their health care needs met, but also their social service needs met. And so I thank our fellow public health colleagues, the community-based organizations that we partner with, who all come together to ensure that we deliver person-centered care services to all of our residents, to ensure that we address the obesity, the diabetes, ensure that our children have access to immunizations, but also ensure that we're able to make sure people have stable housing, have food to eat on their table. I work with Council President Albornoz on work to end childhood food hunger, and I'm grateful for that because I once experienced that so real within my life. And so thank you to my colleagues, to my coworkers behind me, for all of the public health community, social service organizations, the county executive office, as well as fellow council members for the great work you do in order to advance public health in this county.
Yeah, that was great. It feels like applauding. All right, so now I'm going to read this long proclamation. But it's a good one. Whereas National Public Health Week is an annual opportunity to recognize the contributions of public health in improving the lives of Montgomery County residents and achieving health equity as demonstrated in this year's American Public Health Association's theme, Centering and Celebrating Cultures in Health, which embodies the mission of public health to promote and protect the health of people and the communities where they live, work, learn, and play. And whereas Montgomery County is home to many diverse cultures, all of which experience different health impacts based on unique backgrounds and circumstances, while the county ranks first for most health outcomes and health factors among Maryland counties, it is essential that localized data be collected to identify important trends and increase availability of appropriate and accessible care among our diverse populations. And whereas mental health is a critical component of public health, that includes emotional, psychological, and social well-being from childhood through adulthood, and is the most important health problem identified by county residents. While suicide and substance abuse, especially among our youth, are also urgent public health crises facing our community. And whereas health in all policies is a collaborative approach that integrates health considerations into policymaking across all sectors to improve the health of all communities and is a priority in our county. And whereas the Montgomery County Department of Health and Human Services Public Health Services team work daily to prevent, prepare, mitigate, and recover from disease and other public health threats, foster public-private partnerships to increase access to health services, develop and implement programs to address community health needs, provide health education, and monitor, evaluate, and assess community health data and health strategies to improve the overall health of all county residents. Now therefore be resolved that the County Council of Montgomery County hereby proclaims April 3rd through April 9th as National Public Health Week 2023, And be it further resolved that the County Council urges all residents to learn about the role of public health in strengthening the public health system and workforce to help address social and other determinants of health and improve the lives of all Montgomery County residents, and acknowledge the expertise and dedication of our public health workforce. Presented on this 11th day of April in the year 2023, signed by myself and the Council President. Congratulations.